Hi, my name is Gracie and I'm going to be your student nurse today. How are you doing?
Good, how are you?
Good. Okay, so I'm going to close any doors and make sure anyone that you don't want in the room isn't in here just to ensure your privacy. And then I'm also going to wash my hands or use a hand sanitizer in order to make sure we're having great hand hygiene. And then we're also going to wear a mask as is universal protocol just to ensure your safety and mine. So I'm going to ask you a few questions. We're going to start with just what's your name?
Abigail Seipel.
Okay. And then how old are you?
I'm 20.
Okay. And then what sex or gender do you identify with?
Female.
Okay. And then can you tell me why you're here today?
Just for checkup.
All right, that's great to hear. So I'm going to ask you a few questions. They might seem a little bit silly, but we still have to ask them. So could you tell me where you are?
Just the doctor's office.
Okay, and then what city are we in?
Perrysburg.
And then what day is it today?
June 4th.
Yes. Great. All right. And what is your first language?
English.
Okay, so this means that we will not need to use a translator. The patient's overall appearance is great, and she has no physical deformities that are apparent. She's in a good mood, and she appears stable. She has a great speech pattern, she doesn't have any speech impediments, and she can carry on a conversation normally. All right, so I'm going to ask you a few questions. One, how tall are you?
5'4".
Okay. And how much do you weigh?
135.
Okay, we're going to calculate your BMI real quick. And that gives us a BMI of 23.2, which is perfectly healthy within your range. And as we know, you're also very active, which makes perfect sense why your BMI would be right in that range. So I'm going to ask you a few questions about your medical history. Do you have any previous illnesses or allergies?
Just asthma.
Okay. And does anything make your asthma better or worse?
It was just exercise induced.
Okay. And when were you diagnosed with asthma?
I think when I was 10.
Okay. Do you take any medications? Have you received any treatment for your asthma?
I have an albuterol inhaler, but I don't use it.
Okay. When was the last time you had to use it, or the last time your asthma was induced?
I think sometime in junior high I was like 13.
Okay. That's great to hear that you haven't had any issues with that. Did you ever have to seek care or spend the night in the hospital due to your asthma?
No.
Okay, that's great to hear. So I'm going to ask you a little bit about your surgical history. Have you ever had a surgery, your tonsils, gallbladder, anything like that?
Just my wisdom teeth.
All right. And when was that?
When I was 17.
And do you know where you got that procedure done at?
Just oral surgeons of Toledo.
Okay. And did you have any complications from that surgery?
No.
Okay. That's great to hear. So I'm going to ask you a few questions about your social life and make sure you're answering honestly. There's no pressure or judgment in any way. So do you smoke, vape,
No.
use e-cigarettes?
Mm-mm.
Do you use marijuana,
No.
drink,
No.
or use illegal or illicit drugs?
No.
Okay, perfect. Do you take any medications, vitamins, or supplements?
Just birth control.
Okay. And how often do you take your birth control?
Just every night.
Okay. At night? And do you know what the dosage and medication your birth control is?
I think it's Yaz and it's 3 milligrams.
Okay. And then do you take that orally?
Yeah.
How long have you been taking your birth control?
I think since I was 15.
Okay. And have you had any complications from that so far?
No.
Okay. That's great to hear. And do you plan to continue using it?
Yeah.
Okay. All right. So I'm going to ask you some questions about your family history. Do you know of any health issues with your parents?
Yeah, my mom just has AFib, but nothing with my dad.
Okay. And then any health issues that you know of with your grandparents?
With my maternal grandparents, my grandpa does have diabetes, and then
Okay.
my grandma had breast cancer but passed from colon cancer.
Okay. I'm sorry to hear that. I would just advise you to make sure that you're monitoring your heart and probably your blood sugar as you do progress with age, since you are aware of those risk factors. And then next we're going to take your vital signs. So we'll start with your temperature. I'm just going to make sure we sanitize our thermometer real quick. And okay. It reads 97.6, which is pretty close to normal. We have nothing to worry about there. And then we're going to take your blood pressure next, if that's all right with you.
Mm-hmm.
All right, so go ahead and put your right arm up on the table. And we are going to slide your arm right in there. Perfect, thank you. on my stethoscope and put this right under your arm. You're going to feel a bit of pressure, but it shouldn't be too painful. If for some reason it is pain that you cannot withstand, please let me know and I can release the pressure for you, okay?
Okay.
Alright. Alright, I'm going to give this a good squeeze and it'll only last a little bit. All right. Looks like you have a blood pressure of 120/75, which is perfectly normal for your age range, given your exercise level. And you like a blood pressure of around 120/80. So you are in a perfectly normal range, so we're happy to see that. All right, we're gonna make sure we sanitize this after we're done using it, as we did before we started. And then next we are going to check your heart rate. So could you please just lay your right wrist on the counter and I will start taking your pulse. So just relax, it'll only last about a minute. I know it may seem like a long time. Alright, we're almost there, just a little bit longer. Okay, we're finished with that, and it looks like you have a pulse of about 62 beats per minute, which is perfectly within range. Like we said, we know that you're physically active, so that's perfectly within that range, even though it is a little bit lower. And then we're going to take your pulse oximetry as well, so if I could have your right hand back again, just clip this on your finger, and it's going to tell us what your pulse oxygen is. Okay, and your pulse oxygen is 99%, which is perfectly in normal range. And then finally, I'm just going to ask that you relax, and I'm going to measure your breathing rate for another minute. I know it may seem like a long time, but just try to sit still and breathe in and out. Only 10 more seconds, you're almost done. Alright, so your respiratory rate is 12 breaths per minute, which is on the low end of our normal range, but like we said, you're young and you exercise frequently, so that's not surprising in any way. And then finally, I just want to ask you if you are in any pain today.
No.
Alright, that's great to hear. So thank you for coming in. I'm going to go discuss with your doctor the rest of your plan of care, and then we'll get back to you, okay?
All right, thank you.